So you found a way to grow human skin. Tell me about this technology.
So what we utilize is the patient's own skin to regenerate back their own skin. SkinTE is the name of the product that we're actually putting it out. And the way that it works is very simple. Essentially, if a patient has a tissue void or a skin void from a burn or a wound, a provider, a clinical or a medical provider, would take a very small piece of that tissue, send it to us, we would process it and get it back to them within about 24 to 48 hours. They would deploy it in a large syringe, and it would basically be put on like a cake paste or an icing. They would cover that tissue void where they need that skin, and it regenerates full thickness hair-bearing skin that looks just like the patient's own skin because it is their own skin.
Wow, so help me explain this. It's actual human skin that you found a way to regenerate.
Yep, absolutely. It's actually from the patient for the patient. So it is their actual own skin. Majority of skin substitutes that are out there right now today are not of the patient's own skin.
How soon do we expect this to be on the market?
So we're actually putting it on patients through trials, although we're not necessarily required to do that based off of a lot of the way that the FDA regulates things. Being a group of physicians, we felt that it was absolutely necessary to prove to patients and to providers, to the market, and to everyone else that's sort of looking at this company as being a regenerative medicine company, that we are safe and one of the best products you could put on a patient if they have a burn or a wound.
So take me back a little bit. How did you get the idea for this company?
I spent a lot of time looking under microscopes and basically recognized that the less you actually manipulate tissue, the better it actually does. Found out that this was sort of a novel technology, and we ended up patenting it and being approached by a variety of investors to say, hey, why don't we bring this to market and see what we can do to actually help people today.